Dogs are masters at hiding pain. They won't cry, limp dramatically, or hold up a sign that says, "Help, this hurts." Instead, they give us subtle clues. Clues most owners miss until it's too late. That odd sleep position, sudden grumpiness, or non-stop paw licking, it might not be normal at all. Today, we're breaking down 9 surprising behaviors that may look harmless, but could mean your dog is in real pain. Once you see these signs, you'll never look at your dog the same way again. Number 1. Obsessive licking in one spot. When your dog keeps licking the same spot over and over, it's easy to assume they're just bored or grooming. Maybe you think they spilled some peanut butter on their paw and forgot about it. But when that licking becomes obsessive, it's usually not about hygiene or flavor. It's about pain. Dogs instinctively lick areas that hurt. In fact, their saliva contains mild healing compounds, and the repetitive motion helps release endorphins, which soothe discomfort. Think of it as basically their built-in pain relief system. One dog owner shared, saying, "My lab kept licking his front paw for weeks. I thought he was just being weird until the vet found a tiny glass shard embedded in his pad. Poor guy was trying to tell me something was wrong the whole time." All that licking was a silent cry for help. So if your dog zeroes in on one spot with relentless licking, don't ignore it. Yes, it's a weird behavior, but it's also their way of telling you something isn't right. Number 2. Unusual aggression or grumpiness. When your usually lovable golden retriever suddenly growls or snaps when touched, it's tempting to chalk it up to bad behavior or dominance issues. But hold up, this isn't some power struggle. It's more like poking a bad bruise. The reaction is quick, sharp, and very personal. Dogs can't tell you when they're in pain, so they show it. A once friendly pup turning grouchy when you touch their side, leg, or ears might be saying, "Ouch," the only way they know how. This is called pain-induced aggression, and it's one of the most overlooked red flags in veterinary behavior. In fact, one dog owner shared, "I thought my dog hated kids out of nowhere. Turns out he had a raging ear infection. After antibiotics, total cuddlebug again." The change can be sudden and confusing, but imagine someone rubbing your back when you've got a slipped disc. You wouldn't be too polite either. So before assuming your dog is turning mean, ask yourself, could this be their version of, "Please, don't touch, it hurts"? Number 3. A change in sleeping and napping patterns. At first, it just seems like your dog's living their best nap life. Some even joke about their pup being part sloth. But when your dog starts sleeping way more than usual, or can't seem to settle down at night, it might be more than just laziness or age. Pain can mess with sleep for dogs just like it does for humans. They might sleep excessively to avoid moving, or because healing requires more rest. On the flip side, some dogs pace, reposition, or even abandon their favorite bed simply because lying down hurts. It's their version of you tossing and churning with a sore back at 2 a.m. Veterinary behaviorists also point out that if a dog suddenly starts sleeping in odd places, that's a huge red flag. One owner shared, "My dog started sleeping in the bathroom on the cool tiles instead of his bed. Found out he had hip dysplasia and was using the cool floor to reduce inflammation. I felt terrible for not noticing sooner." Bottom line, strange sleep habits aren't just quirks. In many cases, they could be quiet cries for help. Number 4. Losing interest in walks or playtime. There's a point when you realize the tennis ball is getting more action from the dust bunnies than your dog. The same pup who once somersaulted for a game of fetch is now eyeing the backyard like it's Mount Everest. It's easy to label it as age, stubbornness, or maybe just a rainy day mood. But in many cases, a sudden slowdown is pain talking. Arthritis, elbow dysplasia, or spinal issues can make every step feel like a chore. And since dogs can't exactly say, "My knees hate you," they communicate through hesitation. In fact, one owner shared, "My Golden would appear everywhere in the house with a ball in his mouth begging you to throw it. Then he stopped. At 7 years old, surely I thought he was just getting old. But later we found he actually had elbow dysplasia." Veterinary pain specialist Dr. James Gainhart explains that dogs don't go from marathon runners to couch potatoes overnight. It's a slow fade, which makes it dangerously easy to miss. So if playtime suddenly feels optional, your dog might be hurting more than they're letting on. Number 5. A change in facial expressions. Not every sad puppy face means your dog is pouting about not getting a second treat. That distant stare, squinty eyes, or droopy ears might be doing something far more serious, like speaking the silent language of pain. Veterinarians have actually created a tool called the Dog Grimace Scale, designed to read those tiny shifts in expression that often go unnoticed. Tense muzzle, flattened ears, furrowed brow. It's not canine poetry. It's discomfort written in wrinkles. Most of us aren't trained to read facial cues in dogs the way we are with people. And unless you've studied thousands of selfies of your dog, okay, some of you probably have, you might not catch the subtle signs. In fact, a vet tech shared, the client said the dog just looked unusually down. They were shocked to learn he had a fractured tooth causing serious pain. After treatment, his whole face lit up. So the next time your dog looks oddly spaced out or gives you a heavy-lidded stare, they're likely not being dramatic. They may be silently asking for help. Number 6. Showing unusual posture or movement. Some dogs sit with loaves of bread. Others suddenly start stretching like they're channeling their inner contortionist. But before you call it just one of their weird little things, take a second look. Because when dogs hold strange positions, they're often trying to escape pain, not entertain you. For example, the classic prayer stretch, chest down, hips up, isn't them bowing in gratitude for treats. It can signal abdominal pain. Or a curved, roach-like spine might mean back issues. Dogs with sore necks may refuse to turn their heads. And hip pain can lead to sloppy side sits instead of the usual tucked-in position. One confused owner shared, "My dog kept sitting sideways, and I thought it was cute. The vet said it was early hip dysplasia. I had no idea that was even a thing." Your dog's body language is a window into how they're feeling, so always pay attention. If your pup starts striking odd poses, you may want to check it out. Number 7. An unusual change in breathing patterns. Ever catch your dog panting like they just ran a marathon while lying on the couch? It's easy to laugh it off as excitement or a weird habit, but when the temperature is fine and they haven't been moving much, odd breathing can be a red flag for pain. Rapid panting, shallow breaths, or strange breathing sounds often indicate your dog is feeling physical stress. Just like how we tense up or change how we breathe when something hurts, dogs do the same, but they can't actually say, "My ribs are killing me." In fact, one dog owner recalled, "My dog started breathing weird at night. Not quite panting, but not normal either. I thought it was anxiety until the vet found advanced dental disease. After pulling some teeth, his breathing finally went back to normal. It was so weird." If your pup's breathing feels off, don't just shrug it off as excitement. It might be their way of whispering, "Hey, something hurts." Number 8. Increase in vocalization. Your dog suddenly won't stop whining, whimpering, or barking at seemingly nothing. No, they're probably not rehearsing for a canine opera. Rather, when a usually quiet pup starts getting vocal out of the blue, it's often a not-so-subtle cry for help. Dogs in pain may vocalize more because it's their only way to express discomfort. Yelping when jumping, groaning while lying down, or whining for no clear reason can all be signs that something hurts. In fact, one owner shared, "My senior beagle started whining at night for no reason. I thought it was separation anxiety until the vet found arthritis in his spine. We got him on pain meds and the whining stopped completely." If your dog suddenly sounds like they've discovered their inner drama queen, don't just tell them to hush. Seriously, look into it, and maybe even take them to the vet to check it out, just in case. Number 9. A change in appetite. There's a reason sudden changes in appetite feel so alarming. It's one of the few instincts dogs rarely ignore. So when a usually ravenous pup turns their nose up at dinner, or a finicky eater starts inhaling kibble like a vacuum, something deeper might be going on. specifically pain. In many cases, discomfort, especially in the mouth, stomach, or joints, makes eating an unpleasant task. Others may eat more than usual, almost compulsively due to chronic pain or side effects from pain medication. It's a little like how people react differently to stress. Some skip meals, others tear through a bag of chips without realizing it. Also, dental issues are especially sneaky. Dogs might tilt their heads while chewing or abandon hard kibble for softer treats. One veterinarian recalled saying, "One of my clients told me his lab lost interest in food. I said to bring him in immediately, because if you know labs, losing interest in food is not a thing that happens unless something's wrong. And just like I suspected, we discovered a cracked molar." What seems like a food quirk might actually be a cry for help, because even the most predictable eaters change when pain is at the table. Hey, if you enjoyed this, you'll probably love this video here. And if you hit subscribe, I'll donate a meal to a rescue dog on your behalf.